Hi, I'm Dr. Mark Lorenzato. This video is in preparation of a cervical screening. Cervical screenings are done mostly because human papilloma virus is a causative agent for cervical cancer. If we find the presence of HPV or human papilloma virus changes in the cervix, it does not mean you have cancer, but it does mean that the cells are atypical and need to be observed and perhaps eliminated from the cervix. So I encourage all women to follow their HPV status to get immunization as possible and to follow through with this video and understand some of the details. Cervical cancer results when human papilloma virus of several serotypes, member of the family, infect the cervix and result in changes that progress and are not caught on this exam. HPV is the most common sexually transmitted disease, or one of them, and there are various serotypes that can contribute in that to different problems, including cervical cancer. After exposure to HPV of these difficult serotypes from sexual intercourse, it takes several years to develop precancerous conditions in the cervix. HPV vaccination significantly lowers the risk of cervical cancer if it is given prior to the HPV exposure, and probably helps even after HPV exposure because there are a number of different serotypes. The vast majority of HPV-linked cancers are cervical cancers, although HPV is also linked to cancers of the vulva, the vagina, the anus, the penis, as well as the throat and the tongue and the tonsils. HPV infects squamous and glandular cells of the cervix when it is introduced from sexual intercourse. The HPV that affects the squamous cells produces 80 to 85% of the cancers there, whereas only 15% are due to infection of the glandular cells, resulting in adenocarcinoma. When an abnormal architecture is found, using one of several technologies, we'll develop a plan of either to wait and watch or to remove the abnormal cells by some mechanical means. The human papilloma virus, or HPV vaccine, can be given from ages 9 to 26 or beyond. The FDA has approved from 9 to 26, so insurance companies tend to support that. If an individual older than age 26 has not had multiple cervical exposures to HPV from various sexual partners, then he or she may benefit from it significantly. The HPV vaccine is recommended for women and men. It is directed against 4 specific serotypes. If it is of the Gardasil type, the Cervarix vaccine covers HPV types 16 and 18. The Gardasil vaccine covers serotypes 16, 18, 11, and 6. The 11 and 6 serotype also cause genital warts, so therefore the Gardasil vaccine also protects against genital warts to a large degree. Both vaccines are given as 3 doses, times 0, 2 months, and 6 months. The majority of women exposed to some of the 15 risky serotypes, which include 16, 18, 31, 45, are at greatest risk of HPV to develop cervical interepithelial neoplasm, which can progress to cervical cancer. The HPV vaccine is recommended for men for the prevention of women's cervical cancer and for men for the prevention of genital warts. Besides the vaccine, it's important to know that nutrition has a large play in whether an exposure to an HPV serotype that is potentially malignant will progress to cancer. Women who smoke have a much higher conversion rate. Those that eat junk food have a higher conversion rate. I highly recommend good nutrition and adequate vitamin D, as vitamin D has been shown in other cancers to be very beneficial, to have it at a reasonable level between 35 and 70 in your bloodstream to avoid progression of cells to cancerous cells. Condoms may be of benefit, but skin contact outside the vagina is sufficient for transmission. The carrageenans can be used as sexual lubricants, and they effectively kill HPV, although they can inhibit an immunological response. Their net effect is thought to be very beneficial. we will use one of several pathologies, probably SurePath, which is a liquid-based cytology system, to look to see if there is a problem with your cervical cells. How often a woman does a pap smear depends upon a number of effects, and if an abnormal pap smear is found, we should very much adhere to the recommendations and the physician's judgment about how to progress. Women with findings of recent cervical cytology tests that have been normal generally can be followed up more than the yearly basis, at every 2 years perhaps, although for those of us who have seen cervical cancer in women and the devastating results, we tend to want to be a little bit extra vigilant and see a woman every year to do a pap smear and evaluate. In the event a woman's been given the HPV vaccine before sexual intercourse, then she has a higher chance of not progressing, and it depends the number of partners she has. It is recommended that women be screened irrespective of their sexual orientation, as it can be passed within groups as well. There are benefits in the cervical screen of both visualizing the cervix and seeing if it appears as an abnormal architecture, as well as taking the microscopic samples. CIN is cervical interepithelial neoplasm. It is a spectrum of abnormalities that can be seen and lead to cancer. It is graded. We grade CIN. It is a precancerous condition that can sometimes resolve just by watching, especially with good nutrition and avoiding cigarettes, and it also can be progressive, so therefore it generally has to be watched very carefully. Most often is caused from chronic exposure to HPV. The results of abnormal pap smears and liquid-based cytology are reported by pathologists using what's called the Bethesda System. Instead, CIN is diagnosed and graded by biopsy of the cervix. There is an overlap between the two systems. Sometimes CIN can be assessed using the Bethesda System. Abnormal pap smears are graded, giving us a way to determine what the next step should be. Atypical squamous cells, ASC, need to be rechecked and consider HPV tests. This will look at the serotypes that are present in the tissue. It is the Cervisto test. Atypical squamous cells of undetermined significance should be followed closely the same way. Atypical squamous cells that cannot exclude high-grade squamous cell lesions are an alarm, as are low-grade squamous cell endothelial lesions, which are LGSIL or LSIL. The CIN, as I said, CIN1 correlates with squamous cervical precursor lesions. Watchful waiting is generally done, nutritional plans, not smoking. Higher grade lesions are followed more aggressively. These correlate with CIN2 and CIN3, squamous cervical precursor lesions. Squamous cell cancer is the cancer that we will address aggressively if it is seen. Atypical granular cells also need to be evaluated and ranked as whether they are pre-neoplastic or neoplastic, looking like they're cancerous. If one is found to be suspicious as an adenocarcinoma in situ, it is generally removed. Your physician will relate these more rare glandular cell abnormalities if one is found. The FDA has approved Human Papilloma Virus test as a follow-up for women who have ambiguous cervical screen test and for women over the age of 30 for general cervical cancer screening. Cervisto is the present one available. A Cervisto HPV-HR from Hologic is a 14-type high-risk screening test which can differentiate between CIN2 and CIN3. So in the event you have CIN2 or CIN3, the Cervisto is indicated. How often do you need a PAP? Well, it depends on some things. If you're not sexually active, you're not being exposed to HPV, you've had a normal PAP in the past, and you recognize that it can progress to abnormality over several years, you still need to be followed for several years. HPV 3 years ago with a normal PAP, maybe we don't need it as often. abnormal pap vary closely depending upon the abnormalities seen. An overview: cervical cancer screening is very good preventive health care. Cervical cancer results most often are from human papilloma virus. Therefore, it is important to be vigilant about finding changes caused by this and to remove abnormal cells. Smoking is a risk factor. Having multiple partners is a risk factor. The vaccine can prevent the majority of cervical cancers, but it is recommended to continue to have pap smears until more data is acquired. If you have an abnormal pap, it is important to either repeat the pap as suggested by your healthcare team or follow the action suggested by your team and watch the video on abnormal pap screenings. The technical aspects of cervical screening are important because they determine your risk of cancer as well as your list of risk factors. Please ask questions. With the cervical screening exam, we've collected some cell samples to evaluate for the possibility of atypical findings in the cervix. In the event of atypical findings, we'll notify you and have you come back or see a gynecologist. I've also gone through the recommendations for human papilloma virus vaccination. This is available for women as well as men. Other parts of your physical examination other than the cervical screen need to be looked at separately. We'll do that. Thank you.